Whether you're joining us online or you're here in person, it's a blessing for you to join us. This has been a special event. I've been looking forward to this for a few months. And we're here to talk about, unfortunately, a very difficult topic. But it is a topic that has thrust upon us. Perhaps the greatest reduction to the absurd of what's come to be called gender ideology is the effects that it is having on children's minds and bodies. The result of this happening for most people and most families behind the scenes has meant a number of teenagers that have come to regret their decisions, have worked their way along the pathway, so-called gender-affirming care, which is a euphemism for a particular pathway that starts usually in schools behind parents' backs. It's called social transition. It's really a psychosocial intervention in which children's names and pronouns, the ways in which they're treated and described in schools changes, then often followed by puberty-blocking drugs, cross-sex hormones, and then later in adolescence, radical surgery on their bodies. People who have gone through this and then have regretted that fall under a name, and we don't have a better name for it, so it's called detransitioners. We will maybe here today figure out a better name. Actually, I don't like that, but that's the term we're stuck with. And I am joined and delighted to be joined by a new friend, 18-year-old young detransitioner from Central California, Chloe Cole. Chloe, thanks for joining me. So Chloe, you hail from the great state of California, and so I can tell you, those of us that are not in California tend to think that the craziest stuff only happens in California, but the reality is this stuff is happening everywhere. But you, in some ways, you've described yourself online, I know, as the sort of canary in the coal mine on this issue. So you were about 12 when you started suffering gender dysphoria. You started early after that. You had a double mastectomy. At 15, very quickly by 16, you regretted it, and you're now 18.
Yeah.
And if I recall correctly, it was just in maybe spring of 2022 that you first talked about this publicly. But let's sort of start at the beginning. Describe those early years, say when you were 12 years old. What was going on? What were you thinking?
I mean, really, I think it's important to start with my early childhood.
Mm-hmm.
I mean, I'm the youngest of 5 kids. I live in a 2-parent household. Overall, I had a pretty, I'd say, normal early childhood, but I wasn't exactly the easiest kid to raise. I did have some behavioral issues and issues with emotional regulation, and I was struggling a lot in school, both socially and with focusing in class.
So would you say both socially, so normal childhood, generally kind of normal family situation, normal struggles or kind of unusual struggles? Because of course, all of us that went through school pretty much uniformly say we didn't have that great of experience all the time, but would you say you had some very particular challenges at this stage?
Well, I started getting bullied at a pretty young age while I was in elementary school. I didn't really get along with other kids my age. Boys would pick on me. I wouldn't really get along with girls. As I got older, I did find it a little more easy to make friends, but it was usually with boys, and I never really ever fit in with other girls my age.
Would you describe yourself as a tomboy?
Yeah, I was definitely a bit of a tomboy.
Yeah.
I did also have a bit of a feminine streak, but as I got older, I got kind of, I'm not exactly sure why, but I got kind of ashamed of that, and I tried to keep a more masculine facade, I guess you could say. I mean, a lot of the cartoons and comics I would read would portray girls, and especially like the feminine girl characters, as kind of like all like bubbly, pink, stupid.
Mm-hmm. This wasn't your ideal?
No. But, you know, as I started to get older and relationships and socialization at school started to get more cliquey and a little more, I guess you could say, gender-based. I started noticing that I didn't really get along with the other girls, and I started to wonder, like, just what exactly was setting me apart from them. Started to become a little bit insecure about this, and I also started developing some body issues around this time. I started using social media after I got my first phone at 11. The first platforms I used were primarily I used Instagram and Snapchat, which both of those are very like image oriented, and I would see a lot of very, you could say, idealized or sexualized images of adult women and young women on there. And you know, I noticed like a very particular body type and I guess you'd say faces, just features in general that I didn't really match up to, and I started to think like, you know, because these women, they were very curvy, had very large hips, thighs, breasts, small waist, and I didn't really look like this. You know, I was a kid. I wasn't very developed, but I was also a bit on the tomboyish side. I was a little athletic, so I had like larger shoulders. My chest wasn't as developed, and I had a bit of muscle in my body. I also like to have my hair short then, and I mean, I felt like if anything, I looked compared to other girls, I felt like I looked like a boy, and it just felt like I couldn't really match up to other women, and
so it wasn't that you rejected this idea of femininity or this particular portrayal. You just thought this doesn't look like me. This doesn't match me. And so that plus, would you say the kind of influence of social media and maybe things you heard in school? How did you initially get the idea of transitioning?
Yeah, it was through social media actually. This was the topic of being gay or lesbian or bisexual or transgender was never covered in any class that I was in. I mean, I just graduated last year, and the subject was never really brought up. But it was basically entirely just social media. On Instagram, I started seeing like a lot of LGBT content. First through like communities about like video games or anime or artwork. A lot of the people in those communities were, for some reason, they just so happened to identify as like gay or non-binary or transgender, and I started seeing a lot more content that was focused on that. And
I mean, would you say that, so did this idea of transitioning, of identifying as a boy, or at least not identifying as a girl, did it come on slowly, or did you have a kind of realization at some point that you were persuaded? Which one?
So the algorithm started to change and show me more content that was LGBT focused, and it basically went from like artwork and people who just so happened to talk about like their life experiences to you could say it was propaganda, really.
And so did you go through this kind of then the traditional pathway that started with social transition?
Yeah.
Did this happen? Did you decide to do this before you're telling your parents, or did you describe this to your parents? I mean, how did that momentary? So there had to be a transition where you were socially transitioning, right? Describe a little bit about that.
Yeah. So I started to wonder a little bit about what my identity was, why I was attracted to what my gender identity was, and I went through a few labels before I finally settled on, well, I'm just not a girl, I'm a boy actually.
Okay.
I waited a little bit to tell my parents about it. At first, I started cutting my hair shorter and shorter and buying more clothes from the boys' department in stores, and I came out to some friends online, some people who I was closer to at school, one of my older sisters, and then eventually I decided that I wanted to go through a medical transition and that I would have to get my parents on board with that, and I came out to them in a letter.
So how old you came out? So you wrote a letter to your parents. How old were you at this point?
I was 12, going on 13.
So you're 12 years old, and so it really wasn't until you wanted to get, say, on puberty blockers and cross-sex hormones that you decided to tell your parents, and you wrote a letter. So why did you write a letter?
I mean, it was kind of scary to start a conversation like that face to face. I mean, I knew that was a big thing to bring up to them. And I mean, even then, I kind of understood, like, as a parent, that's not really something you would expect to hear from your kid.
Right.
And I was also just afraid of how they would react, so I kind of wanted to give them some time to think about it. And their initial reaction was, I mean, they wanted to be supportive of me because they're my parents, they love me,
Right.
but they also they were kind of cautious about it. They didn't really know how to approach this, and so they decided a few days after that they would start bringing me to a therapist.
Okay, so you hadn't been to a therapist yet, but then at this point you went to a therapist. And so do you remember, was this a psychologist or a psychiatrist?
I can't remember exactly. Just a pediatric therapist, I believe.
Okay. Okay, so what happened then? Because this is, of course, for me and all the parents in the room, this is this is sort of the question: what happened with the therapist?
I mean, the first therapist I had was pretty lousy. He didn't really do much. He kind of just, I mean, the approach that pretty much every physician, every psychologist I had was just the affirmative approach.
Right.
And he never really questioned anything. I mean, there was some stuff going on at home and school that he never just really, I just went unaddressed. It was never really touched upon.
So he started right off, as you said, the affirmative approach. So in other words, assuming your self-report that you're really a boy, he simply took that at face value. Okay, that's crucial, and went from there. So it was a starting premise of the session. It wasn't something that you spent any time exploring.
Yeah, about a month after I was referred to that therapist, or about 1 or 2 months, I was referred to a gender specialist, I think, who was the one who diagnosed me with gender dysphoria. And we switched over to another therapist because that first therapist, I'm not exactly sure what happened to him. I don't know if he was like fired or they just left. But just a few months after my diagnosis, I was referred to an endocrinologist to try and get me a prescription for blockers and hormones.
And you're still 12 at this point?
I'm 13.
So you're 13. Okay, so you're the ripe old age of 13 at this point, and not 12. And so you started on puberty blockers before cross-sex hormones, or it sounds like this happened. Okay, but there wasn't a whole lot of time.
No, not at all. I'd say it was only about a matter of like 3 to 4 months between the diagnosis and then being referred to the first endocrinologist, who actually didn't. He refused to give me a prescription because he said that because of my age, there would be risk for my brain development. But yeah, I never heard that again from any medical professional.
Did you go to a different endocrinologist then at that point? Okay,
yeah, and after about 1 or 2 appointments,
okay.
She gave me and my mom the consent forms for blockers to sign off on, and then about a month after that, I started blockers, and then after that first blocker shot, I got the consent forms for testosterone, and after a period of about 1 to 2 months, I started on the testosterone. And by this point in time, it was only about half a year since the diagnosis.
Okay, and so had you already started puberty at this? I'm trying to, and so I guess that's why the puberty blockers then, depending on where you're in puberty, the thought would be, okay, we could do this for a little bit, but then you're going to transition very quickly into cross-sex hormones. And so, so how can you describe the experience of what it was like when you first started receiving testosterone?
Yeah, so I started puberty fairly early. I was about 9 years old, and that's kind of what fueled the onset of my dysphoria, I would say.
Yeah.
So I was already fairly developed, I would say. When I started on the blockers, it basically put me into a state of artificial menopause, so I started to become a little bit depressed. I was a little lethargic, and I was also experiencing hot flashes, not quite unlike women in their 50s and 60s and so on.
Very premature, menopause. So that's you have a few months of something that makes you lethargic and tired and feeling strange.
Yeah. And then I get on the testosterone, which I was basically waking up every day just hoping to start on it as soon as possible. And so
How did it make you feel? Did
when
it
I
make
finally
you
got on
strong,
it,
or what? How would describe the feeling of the testosterone initially?
I mean, it felt great.
Yeah.
I mean, I finally had hormones back in my body and had my
Mm.
energy back, and I felt better than ever. I felt like I was healthy and confident, and um, after only maybe about 2 weeks, my voice started to drop, and it was
Okay.
pretty dramatic. It was one of the first changes that was brought on, actually.
Okay.
And then shortly after that, I started developing a little bit more muscle. The fat distribution in my body started to change to a more masculine appearance, and I started to my jawline got sharper, my hair and eyebrows got thicker, and
Mostly things that the idea of energy and more muscle and less fat and thicker hair, right, and eyebrows. So some have described this as a type of euphoria, right, at least initially.
I felt like I looked good.
Yeah. And so did you have sort of a honeymoon period on the testosterone? How long would you say that lasted?
I'd say maybe about like a year or so.
Okay.
I didn't know that this was a thing, though. I didn't know that. I didn't really understand that how I would feel about transition would change over the course of a few years. But it's important to bring up that there was an incident towards the end of my 8th grade school year when I first started transitioning. I was in middle school. I was already kind of a social outcast at the school.
Was that because of these things, or just?
It was before. It was kind of just like that before. But this kind of, by transitioning, it did get a little bit worse. I mean, when people started noticing that I was changing my presentation, I looked kind of awkward. They did pick on me a bit, and there was one particular boy who would he was really gross. Like he would like make weird comments about me in class to other people. He would physically harass me. He would even spit on me in class sometimes.
My word. And
one day towards the end of the school year, he actually sexually assaulted me. He groped my chest.
In class? In
the
classroom?
It was in a classroom. It was before class.
Wow.
It was full of other people, and it seemed like nobody either noticed or cared. By this point in time, I was only about like a B, about a B cup, I would say. So I didn't think that my chest was very noticeable, and I often wore like T-shirts and hoodies, and I never really thought that anybody would notice this part of me.
Yeah.
But he did, and he took advantage of me, and I wanted to hide that part of me for the rest of my life. I didn't want anything to do with it, and I didn't want the attention that I thought it would bring me.
So, gosh, it's hard not to imagine that's connected to the sort of next step in this story. And so when did you decide, because at this point we're just dealing with social and drug interventions, and then you moved to surgical interventions. So talk a bit about that. I mean, did you, when you started this process, did you realize, okay, a few years from now I'm going to be undergoing major surgery, or did that dawn on you slowly? What was your thinking?
From the start, I was planning on getting it eventually. I think it's important to talk about how in these online communities that I initially learned about transitioning and the process of transitioning from, a lot of these trans-identified females in their artwork, they would often almost sort of glorify the scars from top surgery and the appearance of it. It was almost like some sort of worship of this thing.
Yeah. Yeah, so it's not just an act of removing something, but it's also the sort of fact of it and the photographs that are online. I mean, do you mind talking a bit about that? So when did the process for the double mastectomy, when did this start?
By that point in time, I was in my sophomore year.
Okay. Yeah, a lot of us that are involved in this, I can tell you, have been told that this doesn't happen to minors, incidentally.
Oh yeah, it does.
Yeah.
It happens all the time.
All the time.
Before that, though, I had that honeymoon period with starting my medical transition and starting to see all the physical changes and starting to become more physically fit, more active, and building muscle, and just feeling great about myself. And by the time I was in freshman year, I actually passed as the opposite sex. My voice was deep enough, and I didn't look like a girl anymore.
Wow.
And everybody say for some people from elementary, middle school, knew me as Leo, a boy, a friend. And, I started to fit in with the boys a little bit more and make some friends, more friends than I really had in my previous school years. And I mean, there were even girls who had crushes on me, which did kind of become a problem because I was still attracted to males. I was
Boys.
still yeah. But now I looked like a boy, and most males aren't attracted to other males or people who look like males.
Yeah.
So
Yeah.
I didn't really know that this was something that was going to happen, but my dating pool was pretty restricted.
Yeah, I can imagine.
And this was a major point of distress for me over the years because all my other friends got to go on dates and get into relationships, and I was just completely missing out on this development. And I felt like I was behind my peers, and I was really insecure about this, and I had a lot of shame, and I felt lonely.
Well, and so loneliness, and so you knew, was this doctor advice? What was it that led you to say, okay, I'm ready to take the next step here surgically?
Yeah, so by the time I was in my sophomore year, I was diagnosed with depression and social anxiety, and they started medicating me, actually.
Okay. An antidepressant?
Yeah. They put me on Wellbutrin.
Okay. Was there any attempt by the therapist at this point to disentangle the gender dysphoria and the depression, or
Well,
yeah?
During my appointments, the therapist would ask, "Do your feelings of depression have to do with your gender dysphoria?" And I was like, "No, I mean, I'm already pretty well into my transition, and I pass as the opposite sex, so I don't really get what the problem is." I didn't realize until much later that it was actually my transition that was worsening issues that were going unaddressed or even creating new issues. So in the middle of my sophomore year, I'd been binding for a few years, and I used a compression device called a chest binder, which had it covered part of my torso, and I would wear it for about maybe around 8 to 12 hours a day.
When did you start that? When did you start the binder, wearing the
binder? After the groping incident, actually.
After the groping incident?
Very soon after. That was when I bought my first binder. Yeah. I got sick of wearing this thing because I would have to wear it for so long whenever we had guests over at the house or whenever I was out of the house in public, and I would wear it while working out or swimming, and I wanted to be free of it. It just sucked to wear.
Yeah.
And I had that additional trauma from having been groped, and which I didn't recognize that I had actually during that incident. Because nobody noticed or cared, I just kind of brushed it off as oh, it's just boys being boys, and if I want to be a boy, then I can't cry about it. Yeah. And I knew that even if I was upset by it, I couldn't reach out to anybody because if I brought it up to the school, they'd probably just give the kid a slap on the wrist, and much worse could have happened to me. And I genuinely fell into the delusion that I was actually a boy, despite living in the body of biological female. And naturally, I wanted to look like the boys my age. I wanted to be able to take off my shirt, not have to worry about comments in the locker room, or just be able to work out and swim shirtless.
Okay, so had the doctors at this point, so you're on testosterone, you're using a chest binder, had they described, I mean, thinking back on this, had they described the details of what this would do for your potential capacity to nurse children, to bear children later in life? Was there kind of clear and obvious disclosure of this, or was it mentioned?
Yeah.
So it was discussed.
Yeah, they did tell me.
How did you feel about that? Did you not care at that point, or?
Well, I didn't care about that point because I wasn't thinking about having kids. Yeah. I was 15.
Yeah, you're 15, which no 15-year-old thinks that way. And then you're also saying, you said you're under the delusion that you're a boy, and boys don't have kids.
Yeah.
Is that the thinking?
Yeah. I was well, boys don't breastfeed, so why would I want to do that?
Yeah. Yeah, so this. I think that's an absolutely crucial part of this because it's
Yeah.
very hard. People can understand. It's easy to understand. Okay, I wasn't thinking about having kids when I was 15, but I'm a boy, so I never was actually thinking about the fact that I'm not going to be able to bear children or breastfeed. Right? It never occurred to me because it's not my capacity. And if you're under the delusion that you're a boy, then that's going to be the same kind of thinking you're gonna undergo. So, how did your parents take the idea of the double mastectomy? Did they struggle with that more, or was it simply kind of a part of the process at this point for them?
I think they really did struggle with it. I
Mhm.
mean, throughout my transition, they really did struggle. My relationship with them was pretty strained, especially towards the middle and later stages. They were told by the doctors at the beginning um, that the regret rates are less than 1 to 2%, which isn't
Wow.
true. We don't know that. We don't
No.
know that.
Yeah. We don't have long-term studies.
They
so
weren't told.
Yeah.
They weren't told that the rate of desistance amongst minors who haven't been medicalized is anywhere from around 60 to 90%. There were a lot of things that weren't disclosed to them,
Right.
but they were told that if I wasn't allowed to transition as I pleased, I would have been at risk of suicide.
Okay. So they were told, yeah, do you want a live son or a dead daughter, effectively? So there was absolute certainty on that. Lack of clarity
Mhm.
on the obvious risks or simply the simple unknown of the risk. And then for your own part, you sort of understood at an abstract level, okay, I won't ever be able to breastfeed, but so what? I'm a boy. So yeah, this is the thinking. So do you mind describing a little bit about the surgery and the aftermath and what that was like?
So after my first appointment with the surgeon, I was referred to a top surgery classroom in the hospital building. That was intended for other minors and their families to attend and learn more about top surgery and basically be given propaganda.
Yeah.
That's really what it was.
Yeah.
I mean, even in the surgeon's office, they had like pictures up of they had like photographs of patients who were post-op, and they had like books full of these pictures. I don't remember a single photo of like a botched surgery or really what could go wrong.
Mm-hmm.
Obviously, because they're trying to market this, but
Right.
there could be a little bit more clarity.
Yeah. So.
But when I attended this class, when I looked around, there were maybe about like 12 to 15 other families.
Mm-hmm.
But it kind of shocked me how young or early in the process some of these other kids were.
Was it all kids and parents in this class?
Yeah.
Okay. Okay, so some even younger than you?
I would say maybe as young as 12 even.
Wow.
And most of them looked like they either weren't on testosterone yet, or they just started it.
Mm-hmm.
And it just kind of struck me that they're already thinking about surgery.
Yeah.
But I kind of just brushed it off my head. It was like, well, I guess they're all just like me, and this is normal.
Yeah. So describe a bit about the surgery itself and the aftermath.
I don't know if I really want to go into detail about how they do it. I think it's important to bring that up because it's important to know just how awful it really is, but I also don't really want to discuss anybody.
Mm-hmm. But you've struggled with this, right? This is a huge part of the story, and I know I've watched several interviews where this was a watershed for you, and it's something you're now still struggling with medically, right?
Yeah, I still have some complications years after the fact, some of which have popped up just last year. The way that the surgery was described to me, I guess they kind of watered it down. They simplified it a little bit just to make it a little more digestible for my 15-year-old brain.
Mm-hmm.
I got the most common type of incision. I was actually pushing for a less invasive surgery, but they kept telling me like, oh, there might be some blood supply issues. Oh, that's an experimental incision, when really all this is experimental. But so they made a cut, I think either under or like on the upper side of my breast, and they would take the tissue out, leave some in for contouring purposes, but they would also leave an area of scraped skin, like a deep knee scrape, they said, but more controlled.
Right.
And they would excise the nipples, and then they would put it in that area of scraped skin to, they said, create a more masculine positioning and appearance of the chest.
Okay.
Really, it's like Nazi-era experiments.
Yeah, yeah. So this is both removal of the breast and also reconstruction to try to make it in some way look more typically male. That's the idea.
I mean, if anything, the scars under the chest and around the nipple just make it obvious that you're really female, but I didn't really understand that at the time. Because most men don't have scars on their chest like that. But, you know, after I went under the surgery, actually in the initial moments before I went under, you know, on the morning of, I was pretty nervous. I mean, I didn't have any doubts about it until after it happened, but it was like, you know, I was excited. I was nervous for something that
You're
I saw.
having surgery. Yeah.
But when I was rolled into the operating room, you know, I was kind of just making small talk with the surgeons and the nurses about, like, hi, I'm Leo. I go to this school and so. But I noticed there was like a male nurse in the back. He looked pretty young, but he was just, while he was preparing, he was staring at me, and he had this look on his face. At the time, I didn't really understand what it was, but I think he was.
Was he struggling?
Yeah,
Or do you think he was struggling with what was happening?
I think he must have been thinking like, that's a kid. That's a kid that I'm about to operate on.
Yeah.
I mean, but when I woke up from the surgery and I was fully conscious, all the meds worn off. It was an outpatient surgery, so I went home pretty much immediately after.
Wow.
Yeah.
I didn't know that. Okay. So you went home, and so was this a kind of a cataclysm that caused you to suddenly, I mean, how quickly after this did you regret what had happened?
I'd say about several months after.
It was still a few months.
I mean, when I woke up, I was like, great, this is a big step. I'm finally closer to my real self that I was told I was going to become. And, you know, I was happy. I was glad that I was over with it, and I was looking forward to being done with the post-op process and being fully healed and be able to go out shirtless and enjoy having the bare sun on my chest, I guess. That never happened because my chest still hasn't fully healed, but
so it's been over 2 years
yeah.
now. Wow. Over 2 years. And so it was still several months. Was there a moment in which you suddenly realized, okay, what am I doing here? Or was it something that was slowly dawning? What is it? Is there a specific cause, would you say, that led you to suddenly, you know, move in exactly the opposite direction?
It was a gradual process. You know, once I went home, there was a period for about a week when I couldn't bathe just to keep everything in place and healing as it should. But then after that period of time, I had to go back to the nurses to get all the stitches pulled out, and the sensation, it was very dull, very numb, but I could still feel everything that was going on, and it was like a slap to the face, basically. And then when I went home and I had to start bathing and changing my dressings and looking down at these wounds that were on my chest, the reality of the situation kind of hit me in the face. I mean, the process was described to me, but you don't really understand what it's like until you actually go through it.
So it was still a few months, though, because now you're describing it as a delusion. But, of course, you weren't seeing it as a delusion at that point, right?
I thought that I was going to get better, that I kept getting worse, and I thought it was just part of the post-op process, that kind of depression was just normal and that it would get better over time, but it didn't. Shortly after, I started to realized that I miss looking more pretty, having a more soft, more feminine form, and being able to present myself more femininely and wear like makeup or skirts or dresses and things like that. But I was very ashamed of this because obviously I didn't look like a woman anymore.
Yeah.
I was on testosterone for about 2.5 to maybe 3 years by this point.
Okay.
I didn't look like a girl, and I didn't have breasts anymore.
Yeah.
But in the comfort of my room or whenever nobody was home, I would, I bought some skirts and dresses and worn some of my old girl clothes in secret, and my my feelings about this just got worse over time, and I never really talked to anybody about it. But the next school year, my junior year started up, and then COVID hit, and my grade performance and even my attendance in class had dropped to pretty much near zero. And it got to the point that my parents just had to take me out of school, and they decided to put me in an online-only program. And one of the classes that I took in that program was a class on psychology. And there was a section on child psychology and development and parenting. And there was one particular lesson that was on. It was on an experiment with monkeys, with rhesus monkey infants, that used a. It would use they used surrogate mothers made out of either wire or cloth to. Do you know the one I'm talking about?
I
can't
did, yes,
remember,
exactly. Yeah.
I can't remember
There's
the
a
name.
wire, it is a,
Yeah, I can't remember the name of it, but
yes.
one of the.
But the little monkeys, they want something, even a replica of a mom.
Yeah, that was the first time though that I really had thought about like nursing and breastfeeding and how being a parent might look for me. And one of the takeaways from the lesson was that breastfeeding is a major part of building the bond between mother and child, and that bond will later affect a child's social and emotional and cognitive development. And I realized that when I got my breast taken away, there is so much more that was taken away than just some organs, like I thought they were. I felt like a monster.
And this is from an online psychology class on child development.
That's
the occasion.
Learning about being a parent was all it took.
Wow. And rhesus monkeys. It's a highly improbable kind of moment. Honestly, the one good story I've ever heard about the online COVID experience.
I mean, I'm on the spectrum, so I kind of get some weird takeaways from some things. So,
and so you've mentioned that in some of your interviews that you're on the spectrum. And so, was this diagnosed early on, or is this something that? Okay, no, it wasn't. So it's something you've learned more recently.
Yeah.
Yeah. And of course, those of us that follow this know that girls that are on the autism spectrum they're
harder to diagnose.
Yeah, they're hard to diagnose, but they also seem to be, I'll put it in the crosshairs of the evangelists for gender transition, and so much more susceptible to this.
Yeah. I mean, everybody my age that I know is transitioning or is dysphoric. They're either on the spectrum, or they have some other learning disorder, or they have like depression or social anxiety, or they have a history of abuse or sexual assault, neglect, or like issues with their family. So.
Wow. Well, I wish we had more time. We're coming to the end, and so I'm wanting, there's still a major part of your story here because you are now a detransitioner, right? You fully changed your mind about this. In fact, so far as I can remember, was it April of 22? How recently was it that you first spoke about this publicly?
So I stopped transitioning in about May of 2021.
Okay.
And by that point in time, all my relationships in school were basically destroyed by COVID and all the restrictions that were in place.
Right.
So I was pretty much interacting with people strictly online, and I would talk about my transition regret. I got a lot of vitriol and harassment for it, actually, just for talking about my experience. I was told that I deserved to feel this way, or that I was making other people uncomfortable, and that it was harming the transgender community just by talking about my experiences, that I should shut up. And I did for a little bit because I couldn't handle that. I couldn't handle the treatment that I was getting, and I certainly didn't want to harm the community people that I thought loved me and supported me. But at the same time, I started researching detransition and reading into other people's experiences and interacting with other detransitioned people online. And I very quickly learned that all these people and even my medical professionals had been lying to me, and that I wasn't harming anybody by speaking out. Quite the opposite, actually, and that I should continue to speak out.
Absolutely.
And and at first, I just started speaking out on personal social media, and I got a lot of backlash for it. I lost a lot of friends, both online and from school, and I basically had to traverse my senior year completely alone and just pick up the pieces of my life without really any friends. I did persevere though, and I did manage to make some new friends outside of school who I know really support me, and even if we don't see eye to eye on everything, we're able to get past our differences and really have each other's backs. And I've also made amends with my family, and really they've really been the ones helping me get through this. I mean, in that period when I realized that I regretted my transition, there was basically like a week where I just didn't do anything. I just stayed in bed all day, except when I was getting something to eat or use the restroom. My parents, they would come up to my door and like bring me food, offer a talk, offer some support, and I mean that's really what kept me going, honestly.
Wow.
But I decided to go public with my story and start speaking out on Twitter. I'd say in about April of last year. I made my account in February, and at first I used it for like personal purposes. I didn't really take it seriously, but then I realized like I could make a huge platform out of this. I could like I need to spread the word. I don't, when I first started talking about this, it was mostly adults who had transitioned who were speaking about their experiences, but nobody who had transitioned as minors really, and nobody quite as young as I was.
Right.
And despite that, I knew that there has to be a lot more other kids who are in my situation, and they almost definitely are in the situation that I was, where they're being silenced by the people who they thought supported them, and they need a voice. And I wanted to be a voice for them and encourage them to speak up as well.
It's hard to believe. So you have not had a Twitter account even a year yet. The amount of bravery for an 18-year-old, especially given what you've described, honestly, it's just absolutely staggering. Everyone that sort of gets into this issue probably has some kind of personal loss. Yours has been quite visceral. But I'm certainly, just speaking for myself, convinced that your testimony is absolutely crucial. You're an amazing young woman and an amazing testimony. And I hope you find a much larger community of support than of detractors. I want to open it up at least for those in the room to be able to ask questions. But we're really thankful to have you in this fight.
Thank you so much for having me here.
It's so good. So I don't know where the microphones are. So, okay, so we have a microphone.
I do have one thing to add, though. My parents get a lot of crap from both sides. I mean,
I'm sure.
I mean, people on the right and feminists tell me that I should go out of my way to sue them, and that it's their fault that they got me into the situation, and it's really not true. I really don't believe that. People often talk about how the kids in these situations are vulnerable, but I think really it's the families as a whole that are vulnerable. I mean, my parents were failed in a lot of ways, not only in this way, but from a young age, they were basically constantly at odds with the institutions. Like
Yes.
they were constantly in a fight with my doctors and my schools. At school I was didn't really have a lot of friends. I had some behavioral issues, and I was also struggling in my classes. I mean, I was a bright kid. Whenever I would apply myself and do tests and things like that, I would get near perfect scores almost every time. But I really struggled with concentrating and organization and staying focused. And
Join the club.
They had an IEP in place for me, but the teachers and the schools never really enforced it. They never upheld it, and eventually they basically just dropped it entirely by the time I was in my junior year of high school.
Yeah.
When in my earlier years, my teachers actually had told my parents that I had some pretty telltale signs of having autism, and they decided they recommended that my parents get me screening. But when they brought me to the doctor, basically all they could get was a young, inexperienced physician who said like, "Oh no, she's too smart to be autistic. She's too well socialized to be autistic. There's just no way." And they wanted to get a second opinion, but my healthcare provider was basically nope.
Wow.
But they did instead diagnose me erroneously, I think, with ADHD, and they started medicating me for that when I was 10.
Okay. Wow. Oh. Well,
So I was, like I said, I wasn't exactly raising me wasn't it wasn't the easiest, and they certainly weren't getting any help from
the officials.
The people that they needed it most from, and so when I got the gender dysphoria diagnosis, and they were told all these lies about it, it was kind of like, it was almost sort of hopeful for them. Like they thought like this was the thing, and that I was finally all figured out, and that I would finally get better from it.
You'll finally get help.
Nope, I was just an autistic girl.
Yeah. Wow. Yeah. That's a really important point, because the reality is the kids are the primary victims, but the parents are very often the secondary victims of this ideology. Absolutely. Okay, so we have a few minutes for questions. Microphone over here. So if you would like to ask a question, out front here. Got one.
Thank you. I guess it's the easy to pick. I'm at the Pontifical University of the Holy Cross in Rome, and also Catholic University here in Washington, D.C. So thanks so much for your testimony, for your courage. I just wanted to ask about the effects that you described of testosterone and on your mood, and also when you detransitioned, what kind of experiences also you had with respect to your mood, because you described it as though it was entirely positive, and I was surprised by that.
It actually wasn't entirely positive. At first it was like, wow, this is amazing. Like I feel great, and I felt like I looked great and I had control over myself. But over time, I started to lose that feeling of control, and it actually made it more difficult to regulate my emotions. I was prone to anxiety and rage, and I fell into pretty deep depression. It actually caused me some physical side effects as well, namely, after about a year or so of being on testosterone, I started experiencing some urinary tract side effects. I was more prone to getting UTIs, and sometimes I would even get blood clots in my urine. And this actually got worse after I stopped taking testosterone. I did go cold turkey off of it. I didn't really have any guidance, and I just wanted to be done with it, because I was sick of taking it. I was sick of lying to myself, and I just wanted to be over with it as soon as possible. But the issues with my urinary tract actually temporarily worsened for a few months, and I lost my appetite completely. I lost around like 25 pounds just in a matter of 2 months, and I was having digestive issues as well as issues with my emotional regulation, because, I mean, my hormones were just completely messed with. And it was, I mean, not only did I have to deal with that, I mean, hormones are involved, sex hormones are involved in more bodily processes than we realize, and that includes emotional regulation. And on top of that, I was dealing with the distress of stopping my transition, having been wrong, the shame around that, the lack of support that I was getting, and the having to deal with having to think about all the implications for my health and my life going forward.
Well, Brandon, right here.
Hi, Chloe. I'm just astonished and just blown away by your bravery. We're so grateful that you're here. As I've been interviewing detransitioners lately, they're going to endocrinologists who are trying to help them, but they even tell me that the endocrinologists, they measure their hormone levels, they're tracking their various things, but even they don't really know what to do because with every person it's different. But could you maybe shed some light on what do you think the greatest medical needs as detransitioners start to recover? How can, for people who want to help them both recover psychologically and recover medically, endocrinologists, in terms of what are the best helps and what are the most pressing needs that you see? And I'd also be interested in knowing, what are you hearing now as you've come out versus when you started from other detransitioners? How has that changed even in the brief span of time you've been more public?
I mean, in my experience, I didn't really get any help at all, even from the endocrinologist. I had to request my own blood tests, and they weren't routine. They weren't like scheduled or anything. And this is, I guess, it's kind of on me for not scheduling. But after just a few months of getting those blood tests, I did stop. But all around, I didn't really get any support. Even my therapist and my gender specialists who referred me to the surgeon were kind of in shock. They were at a loss of what to do, what to say to me, and I think we definitely need to revamp the system. I don't know. I'm not exactly sure how, but there needs to be more monitoring, definitely, and sorry. What was the last part of your question again?
The second half of the question is, versus when you started versus now, what is I would assume there's been an increase in what you're hearing from other detransitioners, and what are they telling you now that you've learned since when you first started? Speaking out more.
I mean, when I first started, it was really only people who transitioned as adults who were speaking out. There was the odd person who, some of them had transitioned while they were minors, but by that point in time, they were already in their they were already in their late 30s. Their late 20s to early 30s, and there certainly weren't any people like me speaking out. But now that I've noticed a lot more people who were transitioned as minors coming out, and they're getting younger and younger.
Just all the way over here on the left, and then we'll move to the other side of the room.
Hi, Chloe. Thank you so much for sharing your story. I have to say that you speak very eloquently about adolescence for somebody who is so young, and very honestly, because I think even many adults don't actually have that ability to be so transparent about the challenges that they had during adolescence. So thank you for sharing. I have one question, and that is, when you were experiencing gender dysphoria, did you actually have an idea about your future, about turning into a man, or was it in the moment about not wanting to be a girl and becoming a boy?
I mean, I did have some ideas about what being a man would look like, but it wasn't really fleshed out. It was really more of a in the moment kind of thing.
It was still about your future long term as an adult. It was it in the moment about, you know, about like age limited? Did you see the long term about what it would mean, or was it very limited to the present experience and challenges about being an adolescent girl?
I'd say it was definitely more the latter. I mean, I was only a kid, so I could only extrapolate so much, but I mean, it wasn't really ever my future and how transitioning would look for me in a matter of several years, 5 years, 10 years, and so on. It was never really addressed at all by the adults.
Hi. As I really appreciate you coming forward with your story. As someone who grew up a very sensitive, creative boy in a very conservative area, I think that I've told a lot of people that if I had grown up with these online communities like Tumblr when I was growing up, I could be in a very similar situation. Like someone could have come, a well-meaning teacher could have intervened in this sense. But at the same time, I think that there's a lot of the roots of the current gender movement, and especially children moving towards transition, are issues that conservatives kind of struggle to address, like mental health, like gender outside typical gender norms and rules, etc. If you had any advice or thoughts on how conservatives could be more open-minded to the root causes of transition, because I think a lot of conservatives latch onto the Dutch method because it bars gender transition as minors, right? But part of it is also that Europe has become a lot more open-minded to children who grow up that are not typically masculine or feminine. So yeah, if you have any thoughts on what you think American conservatives could do to address or be open-minded to the root causes of stories like yours, I'd really appreciate it. Thank you.
So this sort of question about overly rigid gender stereotypes, because you obviously struggled with that. Yeah, I mean, how do we handle that?
Yeah.
Would it have helped if somebody had said, you can be a tomboy and you're still a girl, right?
Yeah.
you don't have to love dolls.
Yeah, and I was often referred to as a tomboy
Yeah.
growing up, but it always felt like that wasn't enough. Like I was something different. Like there was something different about me, and that I really struggled to figure out what it really was. But I agree that I feel like the reason why things have gotten to this point is because of both sides. I mean, for a while, conservatives have mostly just been ridiculing the movement, not really looking into it and really researching it, and kind of just brushing it off as like, oh, it's just this one-off crazy
weird
thing.
crazy
yeah.
thing. Yeah.
But it's not, and it's really captured really vulnerable not only children but parents and young people and even entire institutions.
Absolutely.
And we've really let it go unchecked.
Yeah.
A lot of people don't really understand just the nuance of the situation.
All right, one final right here. Can a mic get there? I keep pointing to places that are hard to get to, but maybe.
I'm going to speak for the parents. We have a lot of policy wonks in here, and I'm one of them, but I will say, as the parent of an 18-year-old on the spectrum, your story is very compelling. So I'm going to ask you a question for every mom and dad and grandparent out here. What do you wish your parents had said to you, and what do you wish they had done when you came to them and said, I feel different, and this is what I think I want to do?
It is kind of hard to answer questions like that because, like, I don't like placing any blame on my parents. I feel like they were victims just as much as I was.
Absolutely.
But there were some things that they could have done differently. And there were a lot of things that they really couldn't do much about because they just were at odds with the school and my doctors. But I did have pretty much unrestricted internet access growing up, and I mean a lot of parents don't really understand just the dangers that the internet presents, especially to a developing mind. You know, sometimes they would tell me like, "Oh, don't make friends with people on the internet. Don't give out your personal information." Like, but they never really hammered anything. They never really went into depth about the real dangers that it could present. They kind of just it was kind of just assumed that I would follow the rules, and they never really monitored like what I was looking at or for how long. I feel like they did give me the phone and a computer a little while I was a little too young. But
Had your first cell phone at 11?
Yeah.
Okay.
And I had a computer at I got my first computer when I was around 9, and usually I would just use it for like for illustration and for like watching like YouTube videos or like shows or like playing video games on it. I think if anything the phone was more dangerous because it was more it's easier to access. You always have it on you, and like that's where most social media platforms are focused on, mobile.
Absolutely.
I feel like if they just controlled that a little bit and had me more focused on things in the real world, like had me in sports from a young age. I mean, they said that they did try to put me in sports when I was pretty young, but I just hated it. They didn't. I mean, I think most kids when they start sports they hate it. But then eventually they come to grow out of it and really like it. I feel like they should have pushed a bit more with that and had me more involved just in school and my community a little bit more.
Yeah, that's a nice way to end. More being in touch with the concrete things around us, less access to the algorithms that control us online, especially for young kids. And that's a warning to parents. Please join me in thanking Chloe Tull. And thank you for those of you joining in person. We have a lunch reception. And for those of you online, thank you for joining us. Lunch on your own. Thank you.